You probably think you know the history of addiction, but what if the story we've all been told is, well, wrong? In her book, Habit Forming, historian Elizabeth Kelly Gray digs up this hidden chapter of American history that completely flips the script. And today, we're going to break down the core ideas.
So take a look at this. At first glance, it seems perfectly normal, right? Just a classic 19th century pharmacy. You've got a trusted professional handing out remedies to some respectable-looking folks. But the secret here isn't what you see, it's what's in those bottles. Many of them were packed with potent, addictive drugs like opium and cocaine, and they were sold totally legally, right over the counter.
And that really gets to the central question the book asks. What if the whole story we think we know about addiction, the one about back alleys and moral decay, is just plain wrong? What if the very first epidemic was actually a quiet one, a domestic one, playing out in living rooms and nurseries all across the country?
This brings us to the book's first really startling argument. America's first drug epidemic wasn't some problem on the fringes of society. It was a huge, widespread, and almost respectable crisis, hiding in plain sight.
Gray's research makes this crucial point. This wasn't an issue for a small group of people. We're talking about countless ordinary Americans, homemakers, businessmen, you name it, who became dependent on substances they bought legally, thinking they were just treating everyday things like a cough or a bit of anxiety. So you have to ask, how in the world did a nation of seemingly responsible people get hooked? Well, the book points to what was basically a perfect storm, a combination of war, medicine, and some seriously aggressive marketing that created a totally unregulated market for some of the most addictive drugs on the planet. It really started with the Civil War, which left thousands and thousands of soldiers dealing with chronic pain and a dependence on morphine. Then came the Gilded Age, and with it, an explosion in advertising for so-called patent medicines. These were miracle cure-alls that promised to fix literally everything. And the not-so-secret ingredient in a lot of these popular tonics? You guessed it, potent narcotics, like opium, morphine, and even cocaine. And the victims? They were a shock to just about everyone. It wasn't just the veterans. Gray's research shows it was middle-class women who were prescribed opiates for so-called nervous conditions. It was professionals and clergy using tonics for a little energy boost. And this is the most shocking part, it was infants being given soothing syrups laced with morphine just to keep them quiet. Now, as this hidden epidemic kept growing, something pretty remarkable started to happen. The very idea of what addiction was began to shift. And that leads us right to the book's central thesis. This profound cultural change from seeing addiction as a vice to seeing it as a disease. Just think about how huge this shift in thinking was. The old way of looking at it saw the inebriate as a sinner, someone with a character flaw. But then this new, medicalized idea of the addict emerged, a patient who was suffering from a disease caused by the drugs themselves. All of a sudden, this wasn't about weak willpower anymore. It was about the chemical hijacking of the brain and body. And this right here, this is the absolute core of habit forming. The book argues that this one conceptual leap, from seeing addiction as a moral failing to seeing it as a medical condition, was a revolutionary moment. It fundamentally changed everything that came next. So, this new understanding of addiction as a public health crisis, not just a private sin, directly led to people calling for the government to step in and do something. And it all came to a head in one pivotal year, 1906. This is the year the federal government finally stepped into the ring. With the Pure Food and Drug Act, the whole era of secret ingredients was over. For the very first time, companies actually had to tell people what was in their products. Now, it didn't make these drugs illegal, but it was a radical first step toward regulation. It gave power back to consumers and was a clear acknowledgement of the danger. Okay, so why does a story about 19th century patent medicine actually matter today? Because, as the book makes so powerfully clear, this history never really ended. We are still living with its consequences every single day. I mean, just think about the debates we have right now. That tension between personal choice and a medical disease. The arguments over government regulation versus corporate freedom. These are not new conversations. They are echoes of the exact same debates that were forged during America's first, and largely forgotten, drug crisis. And this leaves us with a final, kind of haunting question. Habit forming reveals that our modern struggles with addiction aren't new. They have deep roots that stretch back over 150 years. The critical question is,
Knowing this history, can we finally learn from the past? Or are we just caught in a cycle, destined to repeat it?